Welcome to Health Bulletin. Today, we're diving into one of the most critical discussions from the Global Pandemic Preparedness Summit 2024, held recently in Rio de Janeiro. The panel led by Dr. Rick Bright, a renowned figure in the field of pandemic preparedness, and a former director of the U.S. Biomedical Advanced Research and Development Authority, or BARDA. Dr. Bright brought together top experts in vaccinology, epidemiology, surveillance, and outbreak response. This is a crucial topic as we continue to face the threat of infectious diseases that jump from animals to humans. They explored whether our global health security system is adequately swift and effective in countering such threats. Here are key insights from this conversation.
Well, with H5N1, the risk is increasing daily. It's a virus that we've known about for a long time, and historically, it has infected about 950 people who have had direct contact with a sick animal, a sick bird, for example. And in that population of direct exposure, about 52% of the people have died. Now we find ourselves in a very different situation because this virus has not only affected wild birds, it's also infected domestic poultry, turkeys and chickens, and now it's spilled over to dairy cattle in the United States. And the problem with that situation is there are a lot of people that work daily in constant interaction with these dairy cattle. And so the exposure level of people working with these infected animals has increased. The chance for infection and spillover in the people is increased. The chance for the virus to mutate is increased. So in the general population, the risk is somewhat low because we're not all milking cows. But in those people who work very close to these infected animals, the risk is very high. And the spillover risk is the more people infected, the more chance for mutation, and the more chance that this will change very rapidly and get out of control. It could be a deadly virus. No, we're not ready. We could not respond with an equitable response if we had an outbreak of avian influenza today. We would not have enough vaccines ready and available to distribute globally, especially to low and middle income countries who are always last in line. In the last influenza pandemic, they waited almost a year to get their vaccine. Nothing has changed since then. We wouldn't have enough diagnostics to be able to conduct the surveillance to inform countries of the risk. We wouldn't have enough therapeutics and drugs available. We wouldn't have enough masks and PPE and respiratory protection. So there's a lot of work that needs to be done. At the same time, I would say we're more prepared because we spent a lot of money 25 years ago. We spent billions of dollars. We built manufacturing capacity around the world. We've done a lot of things, but a lot of that is outdated. A lot of that could be improved with our modern technologies and modern tools. But we do have to invest in that, and we have to invest in it with an eye on equity, not an eye on a charitable donation from high-income countries that would donate what's left when it's already expired, but an eye on equity first, and that's the only way we're going to ever be ready for an equitable response to a pandemic. Well, we just had an excellent panel of experts. And I asked them what one thing they would like to see to get us there, to make us more ready for an equitable response. And one of the most predominant statements was surveillance. We have to not just think about surveillance in the human population, we have to think about surveillance in the animal population, those animals at high risk for spillover and spill back from humans to animals as well in the wildlife. So we're not doing enough surveillance there. That's critical. We have to know what's coming at us, where it is, how it's changing, but we can't do anything about it until it's too late. We also, another thing would be to make sure that we are modernizing, perhaps is the word, our vaccine approaches. We can't rely on a 1940s technology, an egg-based influenza vaccine, for a 2024 emergency response. There are new tools. We have new vaccines. We have super powerful computing capabilities to understand how we can make the vaccines better. is we need to make better vaccines for the world. We also, the third thing I would say is we have to think about how those vaccines are administered. So it can't be a needle and syringe in a super cold freezer storage where very few places of the world have that capability. We have to think about access as well as production. And can we change the vaccines for mucosal delivery, oral delivery, intranasal delivery, or transdermal delivery? Can we make the vaccines more room stable so they don't require cold storage? Can we make the vaccines more cross-protective? So as the virus changes, we're not chasing the virus anymore, but we're out there in front of it with a vaccine that's going to keep it from changing. Those are three critical things we can do right now with innovation, technology, equity in mind first. That would make a huge difference on an equitable response.